All right, everyone, we are going to get started with our first guest speaker. I have the great privilege and honor to welcome Dr. Brittäne Parker. She is a senior associate consultant in the Division of Hospital and Internal Medicine at Mayo Clinic, and she's also an instructor in medicine at the Mayo Clinic Alex School of Medicine. She has an interest in global healthcare, having volunteered on several mission trips, and is passionate about serving her community as a mentor to students and as a medical professional. Please welcome Dr. Parker as she discusses her journey and passion for serving her community through healthcare in A Life of Service in Medicine.
Thank you, Alexia and Alejandra, for the invitation to speak at the National Pre-Health Conference this year. I'm so glad to be here, and it's so important for students to be able to still engage during the pandemic. So I'm so glad to hear that there was a 3-day conference, Research Expo, to highlight careers in medicine and medical research. Exploring different careers in medicine is something that is challenging. And so I'm glad you're getting exposure today. You're also going to learn a lot of things. I looked at the entire lineup, including how to be a competitive applicant in your respective fields. Shavanya Wynn from Johns Hopkins is speaking later, and that's going to be key. She's a friend of mine. And so it's my understanding that we have a lot of different diverse people joining this week. So there are college students from all over the country, and I know there's some international students, some of whom may have already done some medical training in their home countries, and then high school students. So welcome all. I want you all to keep an open mind over the next few days. Even if you have a particular career that you're interested in, this is an opportunity for you to get exposure. And so please take full advantage. I am going to share my screen here. It looks like it's disabled. Okay, there we go, great. Okay. All right, so this talk is called A Life of Service in Medicine, and I wanted to talk to you a little bit about my journey to becoming a physician, and then also just some principles that I learned along the way. And this can be applied to really any career, and I tried to make sure of that. Now, I did not always want to be a physician. In high school, I was dead set on being a mathematician, and I happened to have a wonderful physical science teacher, Dr. Rodriguez, at my high school, who made learning just so fun. So he taught science and he came up with experiments for us. And so for me, that, and as well as him kind of noticing that I had an interest in this, that I liked clinical reasoning, really keyed me in on, oh, there's something else out there that I could do. And he recommended me to a local university to do a science and engineering program. And there I got exposed to chemistry and engineering and all different types of fields. And so I decided that, you know what, maybe I'm gonna be a scientist as opposed to a mathematician. I had many other opportunities to explore, which is what I hope you do. My mother helped enroll me into a volunteer program at a local hospital where we went around and we learned about different careers in the hospital. And that was kind of my first experience to healthcare from a professional standpoint. Now for me, one of the reasons why I ended up deciding to be a physician was because of my grandmother. So she was a nursing aide for many years, and in her community, even after she retired, she would visit people within her community. So we would go and visit the elderly people in her neighborhood. We would go and take them food. She would help bathe them and really just sit down with them and spend time with them and discuss what was going on in their lives. And that was really impactful to me, to see that one-on-one connection that you can have with someone. So what I would say is exposure is so important. So how will you know if you will enjoy a career if you don't know it exists, right? So I want you to think about this. And then I have a true or false question for you. So before I talk about what I studied, I wanted to hear what you all thought about majoring in biological sciences. And is this the best degree to obtain to get into medical school? So I think we have a poll available.
Yes, we do. Which question did you want to ask?
It's the true false question about majoring in biological sciences.
Great. All right, everyone, fill out the poll.
Let me see what people think.
All right, I will end the poll. Here are the results.
Okay, so we've got 82% false and 18% true. So good job, everyone. I would say that is absolutely false. So if we could close the poll. Okay, so my advice would be to major in something that you're interested in. And so a lot of people think that I have to major in a science because that's what's going to make me look competitive. But you will learn what you need to learn in medical school. Now, of course, there are certain prerequisites that are important, but you can do those along with studying something that you enjoy. So I had friends in medical school who studied anthropology. I had a friend that studied music and theater and actually worked for Disney for a time before she actually came back to study medicine. So it's really important to make sure that you are well-rounded as a physician. And so don't worry about, I have to major in chemistry or biology. Choose something that you enjoy. So for me, I wasn't really sure if I wanted to be a physician, like I said. Those first experiences for me in high school and then in that program with science and engineering, I decided to go ahead and study biochemistry. And I did a lot of research during my time in undergrad, and it's something that I really enjoyed. So I enjoyed the physics and the physical chemistry and the organic chemistry. I took classes on nanotechnology, but I also looked for external opportunities to get more experience. And so I did a summer program both at the University of Michigan and UMass Medical School. And there they really helped me learn about critical thinking and, discovering a problem and researching it. And so I provided some resources here on different summer programs. So for those of you who are even high school students, there are high school programs, but in college, there are programs all across the country where you can delve into your interest in research. And so a lot of these programs provide housing and a stipend. One of the websites is the AAMC. So you'll hear a lot about that if you decide to go into medicine. So it's the American Association of Medical Colleges. And their website talks about SERPs, or Summer Undergrad Research Programs. And then the NSF also has REUs. And the largest database that I have found is the National Research Mentoring Network. And they have a huge list of different opportunities for research. And it's not just the applied sciences. There are also programs in public health and many different fields. So just look at some of those and find something that interests you. So if you do research for a summer program or even at your local institution throughout the year, research the lab and find out what they do before you go. Or before you get involved. And this is a really good principle for life, I feel, is to be prepared. So you can ask the principal investigator or the coordinator of the program to have them send you some information or recent articles on whatever you'll be studying. So those are just some tips. The other thing that I wanted to talk about was find opportunities to get involved. So when I was in undergrad, I volunteered at a local hospital. And a lot of these experiences, they weren't directly teaching me how to be a physician, but it taught me about the healthcare system. So my job really was stocking, the supply room, or transporting patients from one place to another, or getting people water. And it gave me an opportunity to really understand what it's like for someone to be in a hospital and what it means to run such a large organization or a clinic. I also shadowed, which is something that I really recommend for anyone who's interested in medicine or in research to shadow a PhD, because during those times, you really find out what it's like to be in that field. A lot of times people think of physicians or researchers and they think it's just glamorous, or they think it's like Dr. House, where you are just so brilliant and you have minions following you around and you're just spouting out knowledge. But it's a life of service. And that's why I titled this lecture that way, because it really is about taking care of patients. And my first shadowing experience was with a doctor, Temitayo Oyekan, and she was a hospitalist, which is a doctor that works in the hospital only. And I just watched her, how she interacted with the nursing staff and the physical therapist. And she was just so collaborative. And then one time there was a patient that was very ill, and there was a code called overhead, and it was her patient. So we ran to the room, and the patient was having a seizure, and everyone was running around. A lot of people were scared. How are we going to take care of the patient? What's going on? And Dr. Oyekan just walked into that room, and she was so calm. And she said, all right, we're going to do this. Let's take vitals. She assessed the patient and treated the patient right there. And of course, I'm standing in a corner because I've never been in an environment like this. And afterwards we left, and I said, I don't know how you were so calm. And she said, the most important thing is to make sure that everyone knows that when you show up, you're going to take care of the patient, and everyone calms down. And that's what they did. And so shadowing experiences are just so important. And then also, I know that before my talk, there was a lot of discussion about how it's really hard to get involved during the pandemic. I know that a lot of undergrad students and volunteers have not been able to go back into the hospitals yet. And Alexia had talked about how you can go online and look for some volunteer experiences. So if you can't work in a hospital, or local charities are not open at this time, there are other opportunities to get involved. Okay, so during my college years, like I said, I did a lot of research and I worked really hard. But one thing that some of you may encounter is that you will have good mentors and good counselors, but not everyone may be as enthusiastic as you are about the path that you are deciding. And what I mean by that is that when I was in undergrad, I encountered a faculty member who really discouraged me from being a doctor. I did a lot of research, like I said, and so he felt that my application was very confusing. He says, I don't know if you're going to be able to explain to the medical school admissions committee, whether you want to be a physician because you've focused so much on research. And that's really discouraging to hear as someone who's a learner and who is trying to make their way forward in a career path that they have chosen. And so I knew what I wanted to do. I knew my why. I wanted to study medicine to help my community and to help people improve their health. And so I persisted. And so one thing I want you to remember is to not be discouraged by people who tell you no, okay? You know the goal that you have. You do your research, you seek out mentors, you ask for help when you need to, and you work hard, but you stand firm on what you're working towards. And so remember to definitely know your why. So for me, I said, okay, I'm still going to go to medical school. I applied, and I was looking for an institution that fit me. oftentimes when you're someone who's trying to take the next big step in whatever career it is, it's tempting to just want to say, anyone please take me, right? So, I'm submitting all my applications and I'll take the first job or the first position that someone gives me. But remember that it's important that you factor in your own educational goals. And so it's a good thing to think about what you're interested in. And if you don't know specifically, if we're talking about medical school, if you're not sure, picking a place that has a lot of opportunities would be important. So one thing I find with some people who are applying to medical school is that they apply to a huge amount of programs all across the country. And you can run the risk of being somewhere, if you choose that place, somewhere that you're not familiar with, or your support system is not there, or it's a city that you just don't like. I mean, for me, I went to a place in the country that was cold, but that was okay with me. But if you're miserable, it's going to be hard to really study and focus. And so remember that when they're interviewing you, you're also interviewing them. Find out if you're interested in primary care or research. Pick a medical school that is really strong in that, or a medical school that really takes community outreach really seriously, and they invest resources in that. So for me, I didn't want to be in a big city. I had interviewed in New York and Philly, and it just wasn't for me. But I wanted to be at a large institution that had a lot of affiliated hospitals. And so I went to medical school at the Medical College of Wisconsin. So this school, that I was looking at, for me at the time, as a student, I was thinking, I want a robust, diverse student population. And so the Medical College of Wisconsin is a standalone institution in the sense that there's not an undergrad attached. And for me, I felt like, oh, that'd be great, because I don't want to compete with undergrads for the professor's attention and office hours. And they also it was a private school, so they didn't have to only choose students or a large majority of students from the state. So they recruited students from all across the country, which really made our graduating class really exciting. I got to meet people from all walks of life. And then the student groups was important for me. So, I was heavily involved in my Christian Medical Association. I was the president of the Wilderness Medical Society. I had never gone camping before joining, and I played sports. So these were all things that were really important to me. And another draw for me was the opportunities for service at my school. So my school had a program called Pathways. And what this was it was an opportunity for first-year medical students to choose a different area to be involved in. So you're studying medicine in medical school and all the basics. But as a first-year medical student, sometimes you can feel very displaced from what you're going to do in the beginning, because it's all basic science. And I know that there are some schools that have changed that, where they have integrated clinical experiences along with the medical portion, the basic science portion. But for my school, it wasn't like that. And so the pathways, you could pick several different opportunities. So there was a physician scientist track. There was a clinical and translational research track. There was a clinician educator. There was global health. And then there was urban and community medicine, which is what I chose. So urban community medicine was a program where you got to choose a project while you were a first-year medical student. And so I chose to work with community members in inner city Milwaukee. And so I wanted to help improve the health of those people. So they're low income, elderly patients who didn't have a lot of access to good, nutritious food, because there was just a lot of corner stores. And so I did that project with several of my colleagues, and we just came to the high rises at the time where they were living. And we asked them, what's important to you? What do you want to know about health? And they told us, we want to talk about diabetes. We want to talk about hypertension. We want to talk about dementia. And so we prepared all of these presentations. But we found that even though we prepared information to present to them, they were really teaching us, because it was often when we would talk about a subject like dementia, we talked about the basic science of dementia and how it progresses. And one of the ladies who was in the crowd said, my husband has dementia, and let me tell you what it's like to be a caregiver of someone who has dementia. And that wasn't something that we as first-year medical students really could provide. She had much more experience. And so we just kind of let her, go ahead and speak on that. So think about opportunities that you may have in your home institution and how you can get involved. Okay, so the sun is shining right now. I'm going to just step away to close the blinds really quickly. Okay, hopefully you can see me a little better. All right. Okay, so another thing that I did, and it was an introduction for me for service, was global health. So after my first year of medical school, and my school didn't have a huge global health program, but I decided that I didn't want to stay that first year between M1 and M2 year to do more research, because I had done a lot of that in undergrad. So I found a company, it was a British company, who would pair students from all over the country and allow them and help them to get housing in other countries to do a project. And for me, of course, I was a medical student, so I was interested in medicine. And so I ended up going to Jamaica, and I lived there for about 3 years. 3 months, not 3 years. I worked at Mandeville Hospital. And there I got exposed to surgery, medicine, OBGYN, and it was just a real gem of an experience, because like I said, the first few years of medical school, you really are just doing basic science. And so I worked with an amazing group of physicians. This is the only picture I will put up of myself, but I'm in the green shirt next to a gentleman, Dr. Wellington, in blue, and he was just a surgeon who had worked in that community for decades. And it was just a really great experience, and that fueled my interest in global health, which continues today. So look for opportunities in medical school and explore there as well. Now, I did a lot of different rotations in medical school that weren't geared to what I'm actually doing now at this point. So at some point, I decided I wanted to do internal medicine in my 4th year of medical school, but I still did rotations in anesthesia, vascular surgery, and urology. And I just really added all of those skills to my tool belt. So you are always learning something new, and you can learn something new in any different experience that you have. So in life, there may be many situations where you're working in an area that you may not specifically enjoy, or it may not be what you want to do in the future, but learn from it. That's what I want to really impress on you. Every experience, every person that you meet, you can learn something new. So take advantage of those opportunities. And then also, knowing what you don't want to do can be even more important sometimes than finding what you want to do the first go around. Okay, so crossing things off the list is just as important. So I wanted to go over a few things that I learned in medical school. Number one is to completely dedicate yourself to your training or to your craft. And this will go for any other specialty or career path that you're going into, okay? So you will work hard, and everything that you do should be done in excellence. So not only what you're doing that you're graded for, but the things that you do when no one else is really watching, because that's when character is really built. And this is something you will develop over time, and it's important in healthcare. And Also, don't feel that you have to learn everything all at once, because mastery really takes time, but dedicate yourself to training. And that's something that I really learned how to do and how to manage my time. You will be in a new environment where there are a lot of high achieving people, and you may no longer be the best, the number one, right? Because everyone is coming from a place where they are highly successful in their home institutions, and you're all coming together. And so that's okay. You have to remember why you are there, to study and to learn, and remember your why. Okay. And so it's not about being the best in medicine and healthcare in general, it's about teamwork. And so even though it may feel like it's a very competitive environment, and it may be for some institutions, remember not to compare yourself to other people, because what you bring specifically to your field, and if you're going to be a physician, to medicine, is really unique to you. So I put this here for a very specific reason. Keep the important things in your life close, okay? Because it is tempting when you go to medical school or to grad school to throw yourself completely into your studies. And I said dedicate yourself, but it's important to also take time for yourself and for your wellness and mental health. For me, I really enjoyed sports. And so in medical school, I would have colleagues that would be in the library from sun up to sundown. And I did that a few days as well, a week, but I made sure that I carved out some time to play softball. So I actually played on 2 softball leagues in medical school, and people called me crazy because they were like, how are you going to study and make a good grade if you're out there on the field on a Wednesday evening? And my response was that if I take this time to step away from my studies, then I'll come back full force, energized and ready to go. And so remember that if you're going to go to medical school, the goal is to be a great physician. And the great physicians that I know have things in their lives that make them personable, that make them interesting, that make them engaged. And it's not just that they studied really hard in medical school, it's the other things in their life. It's their family, it's the work they do outside of the hospital, it's their volunteer work or their philanthropy. So remember to keep the things that make you you with you, and continue that even during your training. So the most important thing to me is to be a well-rounded, healthy, and whole person. Okay, so I wanted to talk a little bit about choosing a specialty in medicine. So for me, again, I said I chose internal medicine. And some people find it very distressing. They're trying to figure out what they want to do. And I will admit that in our country, there is a lot of pressure to, as a high school student, a 20-year-old, to decide what you want to do and get into the field and study and get a job right away. But it's okay to take your time. And if you need to do more exploring, like I said, that's okay. So I wanted to hear from you all about how many specialties do you think there are in medicine, just overall. And so this is another poll that we're going to do. So go ahead and answer that. Maybe we'll give you a few more seconds. How are we doing, Alexia?
doing good. I'll go ahead and end it now. Here are the results.
Okay, all right. So it's a spread, but I see 55% of people said 135, which is the correct answer. So that's a lot. Does that surprise you? I mean, so this information and this data comes from the American Association of Medical Colleges. And so there's 135 different specialties in medicine. And so even when you choose a specific field as a medical student, don't forget that there are still opportunities to branch out and do other specialties from that point. So again, like I said, I decided to do internal medicine residency. It is probably one of the broadest fields of medicine, along with pediatrics and family medicine, because it really is a place where you can then branch off and do many different things. So internal medicine essentially is a field where you're taking care of patients from the age of maybe say 18 and up, and you're focusing on a lot of different internal diseases. And so when you finish your internal medicine residency, you can decide to do primary care. You can decide to do hospital medicine, which is what I do. You can decide to do a fellowship. So from internal medicine residency, then yields cardiologist, pulmonologist, rheumatologist, critical care doctors, right? So there are so many different fields within internal medicine. And this is what really drew me to it initially. Now, I thought in medical school that I wanted to be a geriatrician, which is another fellowship that you would do out of internal medicine. But once I got into residency, and I'll define a few terms. So the first year in residency for any physician in any field, you're considered an intern. So that's the first year. And then the second year, you're considered a resident. And you may have resident year 2, 3. If you're a neurosurgeon, you're going to be a resident in year 6 or 7. So in my intern year, I realized that I no longer wanted to focus just on geriatrics, which is basically a field that takes care of patients who are elderly, 65 and up. And so again, I was opening my mind to other possibilities. And so what I would say I took away from that is to really be willing to reassess where you are and to be able to pivot. If you find something a little bit different that you want to do in life, it's okay to go ahead and change your mind and move in a different direction. Now, for me, it truly was pivoting, right? But I do want to make a comment that not everything will work out smoothly, or it's possible that not everything will work out smoothly in your journey to getting to where you want to be. And sometimes there are doors that are closed and you feel like you may be trying to push through them and it's not really working. And it might mean that it's just not time yet, okay? Or you just might need to pivot a little bit. So it doesn't mean giving up your dream. It doesn't mean succumbing to someone telling you no, but it may mean just changing directions, and that is completely okay. So I wanted to say that there are many opportunities in healthcare. So even after you become a physician and you're in your career, you're never stuck in one thing. Okay, so there are people that decide on a residency, they become a physician, they're working for several years, and they decide, hey, you know what? I want to explore something else. So I'm going to go back and do fellowship. Or they may say that, I want to now, move into pharmaceuticals and work in that space. So there's so many different things that you can do. Also, education is something that is really important. We have to educate the future physicians. So there are a lot of people that focus on that. Medical missions is something that I talked about before. Hospital administration. So, it's important, in my opinion, for physicians to be involved in the decisions that are made in a hospital or a clinic, because, we really are champions for our patients in our community. And any change that is made to a clinic or a hospital will affect our patients. And so, I'm a strong supporter of physicians being on boards of hospitals. You can still practice medicine, but, on the other side, you can be involved at a more administrative level. And the list goes on and on. So for me, one of my passions is education. And so as Alexia had, I think, talked about in my bio, so I'm a hospitalist, but I also am an educator. So I rotate with the residents on the wards, and I teach them there, as well as medical students. And I often have undergrads come and shadow me. And so this is a way for me to serve. So I see my patients one-on-one, I take care of them, but teaching for me is a way that I can help patients that I will never see, right? So, if I teach a medical student the way to do a physical exam well, or I teach them how to think about different concepts in healthcare, they will take that with them and they will help other people. I also work as an associate program director of a residency. So I help interns really navigate the medical system and help them start on their path to becoming a physician and an educator themselves. And so for me, that has been really important. And I don't only do that at my home institution, but I work with other universities, and I help do talks for high school students or college students. And we do fun things like we do, pig dissections, for hearts to see that a heart is really similar in a pig as it is to a human. And so those students learn about heart disease and hypertension, or, we take kidneys from cows and we dissect them, and I teach them about how the kidney works and get them really excited. And that's a real joy for me. And it's something that I do on the side. I'm not paid for it, but it helps me to feel like I'm making a difference in a broader way. And then let's see, I had just some general takeaway points, but first I also want to talk about the fact that exploring in medicine doesn't just end with your medical degree, okay? So medicine is ever changing, and so will your interest as a physician in the future. So not only do I do a lot of work here in my home state, but I also am involved in a nonprofit organization that helps to provide medical care in Nigeria. And so the organization the founders had recognized that there's a lot of poverty in Nigeria, and the healthcare system is not as robust as it is in the United States. And so I actually traveled to Nigeria in January. This is all before the pandemic started. And there I saw patients for several days in schools that had no running water, in abandoned buildings that didn't have windows. So, it was an experience where I was able to just completely throw myself into caring for the people of that community. And now, I came back and I was really excited. I joined the board and am now involved in helping to find out, how do we build a clinic? How do we have sustainable sources of clean water, right? So I'm learning about how to do international work, and how do you build a well. And so these are all things that are a part of medicine, but it's a different view, and it's service in a way that I never really knew that I would be doing. And so we're building a clinic there, and trying to make it sustainable. So one of the things that I think is a big problem with medical missions is oftentimes the people who are being served become dependent on the volunteers that are coming from another country. So those people are relying on the goodwill, the continued interest, and the finances of that group to keep the healthcare system going. And that's one thing that we did not want to do. We wanted to develop something and create a pipeline where they no longer needed us in several years. And so my good friend, Dr. Nwobodo, founded this organization, and has been really thoughtful about how do we go into a community and help the residents the way they want to be helped, engaging them in the process without doing harm. And so I'm really, really excited about this project. Now, your journey is going to look different from mine. And that's okay, and that's good. It's your story. Each step forward, backwards, or to the side is all going to lead you to where you're going to be in the next 10 to 20 years. And so my advice is to just really enjoy it. Okay, so now about the takeaway points, the things that I wanted to highlight. So exposure is important. So talk to as many people as you can. And when you're able to go back into the clinics and into the hospital to get more experience on what it's like to be a physician, do it. Ask maybe, you're a pediatrician who you saw as a child, can I shadow you? Can I come into the clinic and see what you do and what it's like? And I will tell you that most physicians are very welcoming and want to help young learners. So don't be afraid to ask. Explore, I said that many times, do that all around. Do not be discouraged by the no's. Continue to press forward. Know your why. So why are you choosing medicine? Why are you choosing, nursing? Why are you choosing physical therapy or research? And hold that really close, because there will be challenging times in everyone's life who is successful. They have had failures. They have had times where they wanted to quit, especially people who are business inclined. Having a business, even in medicine, having your own clinic, or developing a drug, right? It can be stressful, but if you remember why you're doing it, it just makes it easier to continue to move forward. Find a training program that fits you. Okay, I can't stress that enough. So really research where you're trying to go and to see if they're going to meet your educational needs, and if it's a place that you want to be. Discovering what you don't want to do is also important. So if you try something and you don't like it, it's okay. It's something you can cross off. Dedicate yourself completely to your craft, but remember that mastery takes time. So there's this concept of 10,000 hours. And the first time I heard about this was in the book Outliers by Malcolm Gladwell. And essentially it's a concept that says it takes a lot of practice to be good at any complex task. So the 10,000 hour rule essentially proposes that no one succeeds by talent alone. Achievement is talent plus preparation. Okay, so I often felt in medical school that I had gone away and I was, holed up in a library reading all of this science, and at times kind of felt a little disconnected, but I had to remind myself that I have to work hard at this. I have to take breaks for my mental wellness and for general happiness to be able to move forward. But, medicine and being a physician is a long road. And so give yourself some grace. You're going to medical school, you're going to go to residency, and it doesn't end with residency. When you finish and you become a attending physician, you're board certified, there's still a lot more learning to do every day. Especially when I work with my residents, I will tell you, they keep me on my toes. They ask me questions that I never would have even thought of myself. And so, I'm still just learning, and medicine is a field where you never stop learning, and you can become good at what you do, but also know that there's more to learn. Continue to engage in what makes you you. Don't lose your sight of who you are in pursuit of your goal. There are so many opportunities within healthcare. Remember, there's 135 medical specialties. Don't be afraid to change course and continue to move forward. And the journey does not end with the degree, right? Learning never stops. The other thing that I want to talk about, and I reminded myself by saying read with asterisks, is that I think it's incredibly important as someone who's aspiring to be a physician to really read a lot about subjects around the country. So this is humanities, social justice, immigration, read about the economy, socioeconomic status, and class structure in our country. all of these topics are so important when you're trying to understand the community that you live in and some of the challenges that your patients may have. Now, remember, your life experience is just what you know. But when you read, you get a broader sense of what other people are experiencing and the factors that go into, how things are affected in healthcare. And so, I'm guilty of it too, but, I try and tell people, don't just read internet articles or portions of internet articles on LinkedIn, right? Read books, because that's where you get a lot of knowledge and you really become someone who understands the world and can help your patients better. So that's the end of my presentation. If there are questions, I'm happy to answer them.
All right, thank you so much, Dr. Parker, for your amazing presentation. We will go ahead and get started with the Q&A. Our first question is, how many different doctors should we shadow and how many hours should we shadow them for?
Oh, that's a good question. So, I would say if you could shadow 2 physicians that do something different, that would give you a broader sense of what medicine is, because every physician has their own experience and the way that they practice medicine. But don't be discouraged if you can only find one. Okay, so I only shadowed one physician, Dr. Oyekin, in undergrad. And it was hard for me to find time to do more, because not only was I studying biochemistry, but I also was a resident advisor for 3 years on campus. And I had a lot of responsibility. I had office hours. I was doing programming at my university. But if you could shadow 2 physicians, and I mean, even as much time as a week, and it could be spread over, several weeks or several months, just have a few different interactions with them, because each day looks different for them as well. And so you can get more experience that way.
Awesome. Next question, how do we find these opportunities in a time like a pandemic?
Yes, that's going to be challenging. And, I'm not really certain that you may have much success, unfortunately, during this time. For my institution, we actually had medical students out of the hospital for a few months, and they're training to be physicians. But because of the issues with the pandemic, the infection, the need for PPE, so having enough gloves, masks, gowns, it was too much, and we needed to make sure that everyone who was a frontline worker had what they needed. So my hope is that with time, some of those opportunities will be made available, but also in some of the smaller clinics, you may have more success because it's not like a hospital where you're going to have COVID-19 patients, specifically. So I would try, again, like I said, your pediatrician or one of your parents or friends or colleagues' physician, to see if they would feel comfortable having you shadow them.
Great. Our next question is, what was the name of the British company that paired students in your presentation?
Yeah, sure. So it was called Projects Abroad. And it's an organization that's still going on. And it's the one that I found. Again, talking about people telling I actually initially applied to go to Uganda to work there. It was a little bit of healthcare, but mostly it was like digging wells and different projects. And they told me that no, you can't come, which was really devastating. So again, I said, okay, but I know that I still want to do something that's summer after my first year of medical school. So I continued to research and I found Projects Abroad.
Next question, are any of these opportunities like the research opportunities that you had for non-traditional students?
I'm not sure exactly what they mean by non-traditional students, maybe just students that are not in college, who aren't following
Post-baccalaureate, most likely.
Okay. I believe so. I think you'd have to look into it. There are a lot of spots I know in the last few years that have gone unfilled, and this is grant money that they're getting to provide these opportunities. So I would ask, because they can, the only thing that they can say is no. But I'm sure there are opportunities for students who are non-traditional to be involved in research, because most of us know that the path is not always linear for everyone. And it's okay to take time off. It's okay to explore something else and then come back. Like I said, my friend who worked for Disney for several years before coming back to medicine. So I'm sure you can find something out there.
Great. Let's see. Next question, what would you recommend for high school students interested in public health?
Oh, that's a good question. So I think that, again, maybe talking to one of the local colleges in your area about your interest in public health would be good. Some large institutions will have a public health student organization, a group. If you could make one of their meetings, even if it's on Zoom, or just asking them, either the office of public health at that institution, what they would recommend you do, and what their successful students have done before going into the field. I think that asking some of that and some of those questions may help you give you better idea of what opportunities would be specifically helpful for you in public health.
All right. Did you take a gap year before applying to medical school?
Yes, good question. So no, I did not. I actually went straight through and, really had a lot of help and was really privileged to do so. But I do know that some students either don't get in the first year, or they do take a gap year. And I think it's really great. I sit on the applicant panel for several different institutions here in Arizona. And so I read a lot of medical school applications, and I interview medical students and residents. And it just really is good that you have different experiences, right? So if you're going to take a gap year, I want to know what you did during that time. How did you feel that year? What did you do towards your continued interest in the field of medicine? So it's definitely okay to take a year off, but do something that you enjoy, that's meaningful. And even if it's something, it's just like a job, because some people do have to work, to support themselves. Try and find something on the side that you can do that is not so time intensive, but maybe it's a volunteer project, or it's a volunteer thing that you can do at a local healthcare center, some shadowing. So just continue to be involved in medicine if that's your goal.
Perfect. We'll do one more question. Do you recommend shadowing both DO and MD if you are not sure which route to apply to?
Oh, well, I think if you have the opportunity to do so, then that would be good. I wouldn't say it's a prerequisite. So in my home state, there was a DO and an MD school. And so the physician that I shadowed was a DO. I think, there is a different philosophy between the two kinds of schools, but essentially at the end, we learn the same thing. Osteopathic medicine has more of a focus on physical manipulation, and they do that early on in medical school, where you actually have hands-on experience with patients, and how the joints and work and pressure points and things like that. But at the end, DOs and MDs are equally as qualified. And so if you have more of an interest in osteopathic medicine, then definitely shadow that physician research that. But I do want to stress that both degrees are equally as qualified and end up usually in the same residency doing the same thing.
Okay, thank you so much, Dr. Parker, for joining us today. We are so grateful for your advice and guidance. It was so amazing to hear your presentation. Feel free to stick around for the conference, and if you would like to answer any of the remaining questions in the Q&A, feel free to just type in the answer in there. If you have any questions, feel free to chat me.
Okay,
and
thank you.
We'll move on. Thank you so much. We will move on to our next presenter in a few minutes. So thank you so much, Dr. Parker. Bye. All right.